ideas to put local school wellness policies in action. We're very excited to have you with us today as we spend a little time going through the new final rule of wellness policies, as well as look at some ideas to put your wellness policies to work. We have several objectives for today. First, as I said, we want to review the final requirements. We want to identify some tools to help you implement your local school wellness policy and look at least two ways that parents and school leaders can support local school wellness policies. We have a question box set up for you. Everyone is muted, but if you have a question, please go ahead and enter it into the question box, and we will be able to share these questions at the end of the webinar. So to get us started, I would like to introduce our speakers for today. First, we have Debbie Negri, who is a registered dietitian with USDA Food and Nutrition, and she's been with the Child Nutrition Division for 15 years. She began her career with USDA at the Midwest Regional Office in Chicago, and eventually transferred to the national office in Alexandria, Virginia. Early in her career, Debbie was very involved in the School Meals Initiative, also known as SMI, and she was highly involved in the development of My Pyramid for Kids. Debbie was also a team member in developing the Healthier U.S. School Challenge criteria, and she was a project manager of the 2006 and 2010 Team Nutrition Grant. Debbie was a member of the Food and Nutrition Service Committee to help draft the rules for the National School Lunch and Breakfast Meal Pattern and the local school wellness policies. Debbie attended the University of Rochester for her undergraduate degree in Health and Society and Psychology and received her master's in nutrition from Syracuse. Next, we have Erica Krepp, and Erica is a certified health educator specialist with over 10 years of experience in promoting wellness in a variety of sectors. Erica is currently a nutritionist in child nutrition programs at USDA's Food and Nutrition Services, where she leads efforts related to school wellness policies and improving the school nutrition environment. In this role, Erica has worked on the development of resources that support the development of healthy eating and physical activity habits among children. Prior to joining FNS, Erica was a community health promotion coordinator for Arlington County, Virginia, and she was the catalyst for the expansion of Fit Arlington Healthy Vending Initiative into all parks, community centers, government employee sites, and all public schools. She also acted as a liaison for the School Health Advisory Board and sat on the local school wellness policy committee. Other positions held include project coordinator of the New York City Healthy Hospital Food Initiative at the NYC Department of Health and Mental Hygiene, assistant director of academics at the Allen School for Allied Health Professionals, and program coordinator for Suffolk County Department of Health and Human Services. Ms. Krepp received her Master's of Science degree in Community Health from Hofstra University and her Bachelor of Arts in Psychology from George Washington University. Last, my name is Jill Camber-Davidson. I am a registered dietitian and the school program manager at Action for Healthy Kids. And I have been with Action for Healthy Kids for 5 years now, working on managing our grant we have with CDC, as well as some of our school program initiatives and technical assistance, such as this webinar. As we move forward with this webinar today, I want to point out to you, if you look on the sidebar of your screen, you'll see there is a little handout tab. And if you click on that handout tab, there are 3 handouts for you for today. One is a summary of the USDA final rule that will be shared with you on the slide, but this will also be your copy that you can look at. Secondly, a listing of helpful links on our school wellness policies that you can just go ahead and link on. And lastly, there is a PDF of all the slides here. So if you are in need to have a paper copy to follow along, or you want to pull that out for reference, that is loaded right up here for you right now. Otherwise, as I said, this will be recorded and will be posted on the Action for Healthy Kids website in terms of access, because we'll put it on YouTube, but you'll be able to get the slides and the handouts there as well. So I'd like to turn it over to Debbie now and let her talk to us first of all about the U.S. Local School Wellness Policy's final rule requirements. Debbie?
Hi everyone, this is Debbie,
and I'm excited to walk you through the local wellness policy regulation today. But before I do that, I just want to remind everyone what a local wellness policy is. It's a written document that guides local educational agencies or school districts' efforts in establishing a school environment that promotes student health, well-being, and ability to learn. So it's actually just a written plan. And I am constantly reminded on a daily basis why we have these policies in place. I actually have 2 kids in elementary school. And just last year, I got an email from my first grader's teacher saying that my son Noah had misbehaved and that they were going to go ahead and take his recess away for that day. And I think most parents would say, okay, but little do they know they were messing with the one parent who knows the local school wellness policy in and out. And I knew that that's actually not consistent with our policy. We really aren't supposed to be taking away recess for kids that misbehave or rewarding kids for good behavior with food. So I was able to talk to the teacher and discuss that that really wasn't a good option for him. But it just reminds me, and on a daily basis, that we have this wellness policy in place for a reason. And this particular rule strengthens the policy, it holds the LEA accountable, and it also brings in the community. And so it is very important. So let me go ahead and walk you through that, some of the background on the regulation. So as we know, schools play a critical role in promoting student health, preventing childhood obesity, and combating problems associated with poor nutrition and physical inactivity. So to formalize and encourage this role, Section 204 of the Child Nutrition and WIC Reauthorization Act of 2004 requires each local educational agency participating in the National School Lunch Program or the School Breakfast Program to establish a local school wellness policy by school year 2006. So schools have already been doing that, and initially this requirement defined the local school wellness policy and put the responsibility for developing the policy at the local level so that the unique needs of each school under the jurisdiction of the LEA could be addressed. But each LEA was required to establish a local school wellness policy that set goals for nutrition education, physical activity, and other school-based activities designed to promote student wellness, and include nutrition guidelines for all foods available on the school campus during the school day. And additionally, LEAs were required to involve a broad group of individuals in the development of the local school wellness policy and to have a plan for measuring wellness policy implementation. But more recently, the 2010 Healthy Hunger Free Kids Act added a new section to the Richard B. Russell National School Lunch Act, which expanded the scope of wellness policies and brings additional stakeholders into the development, implementation, and review of the local school wellness policies, and it requires public updates on the content and implementation of the wellness policies. So it's important to emphasize here that the LEAs, they're not starting from scratch. They have policies in place. In school year 2010 to 2011, 99% of students in public schools were enrolled in a school district that had a wellness policy in place. But there is variability in the local school wellness policies, in the strength of these policies, and in the policy enforcement, meaning that not all school children are actually benefiting from these policies that currently exist in their schools. So that means that policies might have been put together and enforced, but in other schools they're not. So it doesn't really matter if the policies are strong or not, they need to be enforced. So through the Healthy Hunger Free Kids Act, USDA was directed to strengthen the requirements for the local school wellness policy and put more emphasis on implementation of the policy. And LEAs in schools are encouraged to identify specific measurable objectives with attention to both long and short-term goals.
Debbie, I'm going to interrupt a minute. We're having some trouble with the slides advancing, so I'm
right. Yes.
Just let me know.
Thanks. Thank you. So on the next slide, you'll see the title of the rule is the Local School Wellness Policy Implementation under the Healthy Hunger Free Kids Act of 2010. And this rule was published in February 2014, and we took comments for 60 days, and we received a ton of comments. Over 57,000 comments, including some from state agencies, local agencies, and nonprofit organizations, and some advocates. And well over 57,000 of those comments were in support of the rule, which was great, and only 130 expressed opposition. So first and foremost, under the final rule, each LEA is required to establish a local school wellness policy leadership. For example, one or more local educational agency or school official who fully understands the wellness policy requirements and who can facilitate the development and updates of the local school wellness policy, and who has the authority and responsibility to ensure that each school complies with the policy. So the LEA is required to identify only the position title, the LEA, or the school official responsible for oversight. For privacy purposes, we're not asking that they publicize an individual's private contact information, but the community should be able to easily access this official to provide suggestions or ideas. And we encourage LEAs to provide a means of contacting this official, maybe a phone number or email. And whoever is assigned to do this wellness policy is going to vary within each LEA. We left this to the LEA to determine who is most qualified for the position. So once that leadership is developed, the next step is to identify specific categories of stakeholders that must be permitted to participate in developing or implementing and reviewing and updating the school wellness policy. LEAs are expected to actively seek members for the local school wellness policy committee. On the next slide, you'll see a list of these examples. School health professionals may include school health service staff, for example, nurses or physicians, dentists, health educators, mental health and social service staff, such as school counselors, may include a local dietitian, physician, medical professionals, and LEAs are strongly encouraged to include supplemental nutrition assistance program educators, the SNAP Ed coordinators on the local school wellness policy committee as appropriate. And the final rule gives LEAs discretion in exactly how they are going to implement this requirement. There may not be enough individuals in each category of stakeholders within a community, and that's okay, or they may not be willing or able to participate. And conversely, it may not be possible for an LEA to permit everybody who's interested in a particular category to participate. So it's really up to the LEA how they're going to work that, but we do not require participation from all of those groups. So LEA's existing school wellness policies should include goals for nutrition education, and this has been a requirement already, but the new final rule requires schools to add goals for nutrition promotion. Nutrition promotion gives students opportunities to choose healthy nutrition choices, and also enhances and encourages participation in school meal programs, and incorporates the marketing and advertising of food. So nutrition education is what teaches students what foods are nutritious, and nutrition promotion and nutrition education are really important together to get students to consume healthier options. And nutrition promotion does not have to be something crazy different from what schools are used to doing, and they're probably already doing some of these things already, like offering contests, surveys, promotion or taste tests, providing information to families to encourage consumption of healthy foods at home. Could be posting nutrition and health posters in classrooms or hallways, in the gym, things like that. And as far as nutrition education goes, including nutrition into health education classes, or including a curriculum that promotes skill development such as meal planning or learning how to read a food label, or integrating nutrition education into core subjects such as math and science or language arts are good examples of nutrition education. And on the next slide, physical activity is not a new requirement, so it should already be included in the existing wellness policy, but updates to the policy may need to be made to ensure that the goals for physical activity are evidence-based, and I'll talk about that in a few more slides. So examples of goals for physical activity could include the amount and frequency requirements, like the days per week and the minutes per day per week, or it could be student fitness assessments and reporting to parents. And just a side note, USDA cannot dictate the amount of time that should be allotted to physical activity during the school day, but the CDC recommends 60 minutes of physical activity for each day for children and adolescents. So we strongly encourage that schools are able to offer the 60-minute goal, since many children spend most of their hours at school. And as far as school-based activities, the final rule does not change the existing requirement for local wellness policies to include goals for other school-based activities that promote student wellness. And an LEA can take a coordinated approach to developing policy by addressing nutrition education and physical activity through health education like tobacco, alcohol, or other substance abuse prevention, the physical environment, employee wellness, family engagement, community involvement. We encourage LEAs to include many activities to support a healthy school environment. Some ideas could be applying for the Healthier U.S. School Challenge, offering staff wellness training to inspire these staff to serve as role models, sponsoring health fairs, or incorporating school gardens. So I mentioned evidence-based strategies before, and under the final rule, local educational agencies are required to review and consider evidence-based strategies and techniques in establishing goals for nutrition promotion and education and physical activity and other school-based activities that promote student wellness. And these evidence-based strategies they've been evaluated rigorously in studies, and they've been subject to peer reviews, and they're so effective that they're supported by experts in the field. And one example of this is the Smarter Lunchroom movement. It's a good example of evidence-based strategies. And some of these examples could be using creative names for fruits and vegetables and targeted entrees, something like X-ray vision carrots, or something, naming these vegetables and fruits different names to kind of pique the interest of students. Training staff to prompt students to select fruits and vegetables, placing unflavored milk in front of the other beverage choices, and bundling grab-and-go meals that include fruit and vegetable items. All of these examples that are included in the Smarter Lunchroom movement have been shown to improve the likelihood that children will make the healthier choice. So the National School Lunch Act requires that the local school wellness policy include nutrition standards for all other foods available on campus. This includes foods and beverages made available but not sold. And that could be foods that are brought in for parties, foods that are given away as rewards, classroom snacks, or incentives. So it's important to highlight that we're not requiring schools to apply the smart snack standards to these foods and beverages that are just given away. But their LEAs must have a policy in place that addresses these foods that are given away in schools. And foods that are sold must meet competitive food and meal competitive foods, the smart snack standards, and the meal pattern requirements as they apply. But as I mentioned before, foods that are simply given away must have a policy that addresses them, but they don't have to be consistent with smart snacks. And I want to point out that because we get this question all the time, there are no restrictions for foods that are brought from home for individual consumption. All right, let's talk about the marketing, policies for food and beverage marketing. The final rule states that LEAs are required to include policies that allow marketing or advertising of only those foods and beverages that are consistent with smart snacks. And for the purposes of this rule, marketing is defined as advertising and other promotions in school. This would not apply to marketing that occurs at events outside of school hours, such as after-school sporting events, but they could extend to those programs or those events if the LEA chooses to do so. So some examples of marketing could be the exterior of vending machines, posters, menu boards, coolers, trash cans, cups that are used for dispensing beverages. These marketing restrictions do not apply to personal clothing, personal items, packagings of products brought from home, or any educational tools that are used. And let's talk about the piece of the regulation that keeps LEAs accountable, the triennial assessment. So every 3 years, at a minimum, an assessment of the local school wellness policy must be conducted, and the results of this assessment need to be made available to the public. And the assessment should determine the compliance with the local school wellness policy, how well is the school or district complied with the policy, how the policy compares to model local school wellness policies, and progress made in attaining the goals of the local school wellness policy. How happy are you with the progress? Should they be changed? Have you met the goals? So all of these must be answered in the triennial assessment. And so in addition to the triennial assessments,
As the community needs change and as goals are being met and as new health science information and technology emerges, it's important that LEAs assess the local school wellness policies and update the wellness policies as appropriate. So the final rule requires that the LEA modify or update the local school wellness policy as appropriate. However, we don't specify the frequency of the updates to be made to the wellness policy. And those will have to be determined based on the content and structure of the plan. But because we don't specify the timing of the updates, we would expect them to be done at least during the triennial assessment. So as far as record keeping goes, there's nothing really new here. Schools are always required to maintain documentation of how they're meeting the various requirements of the school meals program. But we will ask for the written local school wellness policy, documentation demonstrating compliance with community involvement, maybe a copy of the solicitation letter, or showcasing that the web page where the local school wellness policy has been posted, or a copy of the school newsletter or local newspaper, whatever has been chosen to distribute that information. Documentation of the triennial assessment. We will work with state agencies to provide technical assistance and address these situations, any situations as they arise during the implementation. So LEAs are required to inform and update the public, including parents and students and others, about the content and implementation of the local school wellness policy. Any updates made to the policy must be made available to the public on an annual basis at a minimum. And if the LEA updates their policy, if they've added an after-school event or planned a health fair, these would need to be passed on to the public. So to accomplish this, LEAs might post the local school wellness policy on the LEA's website or send a back-to-school message to families notifying them of how they can obtain a copy of the policy, or present the information during a PTO or PTA meeting. Okay. So as far as state agency monitoring and oversight, this is included as part of the state's administrative review of the local educational agencies, and it's conducted once every 3 years. And the proposed rule would require state agencies to include as part of their general areas of the administrative review compliance with the local school wellness policy requirements. And so they'll be looking for LEAs to provide a copy of the appropriate web address of the current local school wellness policy, provide documentation to demonstrate how the public knows about the local school wellness policy. LEA must showcase when and how they review and update their local wellness policy. Describe who's involved in reviewing and updating the local school wellness policy. Demonstrate how potential stakeholders are made aware of their ability to participate in the development, review, and update of the local school wellness policy. And provide a copy of the most recent assessment of the implementation of the local school wellness policy. And finally, the final rule requires LEAs to begin developing a revised local school wellness policy this school year, 2016-2017. But LEAs must fully comply with these requirements of the final rule by June 30th, 2017. So we have a school year to get that done. And as I mentioned before, state agencies and FNS will provide technical assistance to facilitate the implementation of the local school wellness policy requirements.
Great. Thank you, Debbie. And just as a reminder for everybody who's there, we are taking questions in the question box. So go ahead and enter them in. I'm getting quite a few so far, and we will address these at the end of the webinar. Just also to let you know, there is a PDF of the slides in the handout tab if you want to print that out to use and follow along. I had a question about that as well, so I wanted to address that right away. So I'm going to jump in and talk a little bit about putting the wellness component in action. And I actually want to let everyone know that there will be a pre-conference at the Southern Obesity Summit in November that will focus on wellness policies and the wellness policy tool that you're going to see a little bit of right now. But we're going to spend a lot more time at the Southern Obesity Summit pre-conference if you're interested in learning more. So just a little plug there. So I wanted to share with you the Action for Healthy Kids Wellness Policy Tool, which is on our website. And if you go to the actionforhealthykids.org site and click on Tools for Schools, you will come up with a tab, as you see on the right-hand side, where it says Revised District Policy, and then goes back and talks about the Wellness Policy Tool. So we have those ready to go for you. And let me just scroll back here. All right, here it says Wellness Policy Tool. You click on it, there will be your tool that you can use. So this is what the full tool looks like with a lot of different icons, and you might have seen this in some trainings that some of the Action for Healthy Kids team has done, but this is what we're going to use when we talk about some ideas. So when you first look at ideas and you talk about a wellness policy, you want to look at your team. And when you get to your team and really thinking about parents and school leaders, how do you get them involved? And an important piece to remember is you want to really look at the school or the district makeup. Does your wellness committee represent that diversity? Do you include those key stakeholders that Debbie already mentioned? And do those members of the team have the right tools, the right expertise to address some of the issues? Because if you're looking at really putting together a strong policy and some good programs, if you have that expertise on your committee, that makes it a lot easier. So one idea here would be ask parents to join the team. Many parents don't know about what's happening with wellness committees, or they do, but they're afraid to get involved or don't think they can. So go ahead and invite them. Ask them to join. The same with students in terms of asking them to join. Then we move on to our step 2. As I said, I'm going to go through this pretty quickly, but this is the assessment piece, and when you really assess that environment. And ideas here are to look at what are you doing already? What is some really great data sources that you have, that you collect, and can you use those in terms of outcome to assess your wellness policy and how you're implementing this final rule? Because if it's already being done, why not use it? And then also another idea is think about surveying your parent groups or your students, that they can give you some feedback in terms of what the environment is like. So as a health professional, you may have one view, or as a school staff member, you look at the school one way. Your parents and students may bring you a totally different idea in terms of assessing that environment. Step 3 is putting the practice into words. This is drafting that policy. And indeed, final rule looks at a relationship to a model policy, but keep in mind that one size does not fit all. So you'll need to look at your local adaptations and how it fits best for your district. And there are some tools out there, such as the WellSat tool, that you can look at for your language of your policy, to really look at the strong, clear language that your policy has. And in terms of making it official, this is when the board adopts the policy. So ideas here would be to actually go and attend the meeting or talk with your district leaders before they adopt the policy. And then provide the support the policy might need, whether it be communicating with your parent groups or sharing it out or offering to, put something together for a district newsletter, or some different ways that you can help with the official adoption and education about the policy. The implementation step, where we're spending a lot of time today. And what I wanted to point out for some ideas here are, I like to say, the who, the when, and the how of the policy. So you look at this and say, how can parents and student volunteers help us implement it? When can they do things to help implement the policy, and how can they do this? So this may help with your short-term and long-term goals, and as you fill out that action plan. So again, bringing those parents and students into the actual planning process and considering when they're able to do an activity to help support the wellness policy. Step 6 is that valuable feedback. You want to measure and evaluate what's happening. And there's many types of ways you can evaluate, whether I have 4 of them listed here. And just so you know, with this wellness policy tool, when you go on our website, you can click on each of the icons, and that tool piece comes up, and the resources are there, and the information to help you. Like I said, I'm just giving this a quick little gloss over, but if I went to the tool online and clicked on step 6, pieces on, the evaluation piece, or different ways to use the school health index or whatever, will be on the website that you can click through and use as tools. And real question and the idea here to think about is, how will you know your wellness policy is making a difference? This is a question that if you ask yourself as you're looking at your measuring evaluation, I think it will help guide you in the right direction. And then our last step of the tool is the communication piece. And this is what Debbie already shared as what was new in the interim rule and the final rule, is using those multiple channels of communication to inform your parents, your key stakeholders, your students, your community about what's happening. And then the documentation of how you're sharing your results and what your results are. Because as was mentioned earlier in that triennial assessment, this will be really helpful if you have this documented now and you're saving it for when it comes later, 3 years later, when things are coming up. It's sometimes hard to remember everything. You can put this together. Additional resources that we have also linked with our wellness policy tool and our website include webinars like today, some newsletters, all our archived presentations and webinars, our resource clearinghouse. We have state coordinators in 24 states to help really bring everything to the ground level, as well as a school health index version that you can enter online and get a results and action plan, and then our Every Kid Healthy Week in April. So if you check out our website, these are all there for you to look at and use some tools. And like I said, many of these resources are linked with our wellness policy tool and our resource clearinghouse. So you can go either place and they'll come up for you. And another place our resources are linked and you can get into the wellness policy tool is our Game On program. So you can see we have this piece down here about revising district wellness policy. You click on this, it will take you to the wellness policy tool and some different ideas and little activities you can do to help with the wellness policy work. Same is true with the Assess and Track School Progress. Clicking on that will take you some of those activities that are linked to our evaluation step 6 in the wellness policy tool. So again, different ways to try to get this wellness policy and all this final rule broken down into little bite-sized chunks that you can take to your committee, take to your principals, take to your parents, and use them to help make your work stronger and make that implementation a success. One last thing I want to share is some of our tip sheets that are available for download. As I said, taking information to key stakeholders, sometimes it is hard to find something to give them a sheet to have them read. We have a lot of tip sheets that right here you can leave it with them or use it to share ideas. These are all updated. They meet the final rule and have a lot of great ideas. These I'm showing are the fundraiser sheets. They talk about activity fundraisers, fundraisers that aren't food, some other things, and then the healthy food options as well. So again, this is what the tool looks like. As I mentioned, this is our actual poster of it. On the website, it's interactive. You can click on the different steps. It will take you to the steps, the information, the tools and resources to really help you implement that final rule. So again, before I have Erica step in here, just a reminder, put in your questions. We will answer those at the end. And the slides and everything will be posted on our resource clearinghouse, which is one of those ones when you log into our website, you can get there, and it's right by the wellness policy tool. So you'll find them there. And I'll actually put the slides with the wellness policy tool. So if you log in there and find it, you'll be able to pull up the slides as well. So you'll have multiple ways to get a hold of them. So Erica, I want to turn it over to you.
Great. Thanks so much, Jill. And thank you for being such a wonderful partner in building community and school level support for nutrition and physical activity in schools. Action for Healthy Kids is really an amazing organization, and we really appreciate being invited to present the Team Nutrition free resources to help implement wellness policies. I think if we can advance the slide, we're having technical difficulties. We'll go to the next one. Great, thank you. So before I jump in and talk about the different tools Team Nutrition has to implement wellness policies, I want to provide a brief background on Team Nutrition in case you haven't heard of us. Team Nutrition is an initiative of the U.S. Department of Agriculture's Food and Nutrition Service that supports child nutrition programs. The goal of Team Nutrition is to improve children's lifelong eating and physical activity habits through nutrition education based on the principles of the Dietary Guidelines for Americans and My Plate. Team Nutrition provides a number of free nutrition education materials that the public can access through our website. schools that participate in one of child nutrition programs, so the National School Lunch Program or School Breakfast Program, they can also request free printed copies of our materials for their schools using the order form on our website, which I will go over later in the presentation. Next slide, please. I also want to make sure all of the schools on the call are enrolled as Team Nutrition schools. And for those of you on the line that don't represent schools, I want to make sure you're aware of this opportunity to help spread the word. By becoming a Team Nutrition school, you will show your commitment to helping students make healthier food choices and be more physically active. You'll be able to collaborate with other Team Nutrition schools. You'll be among the first to hear about new Team Nutrition materials through our e-newsletter, and receive special nutrition education and promotion materials that are reserved just for Team Nutrition schools. So for example, we ran a promotion with our very popular stickers that promote school breakfast. So only schools enrolled as Team Nutrition schools had access to order those stickers for their students for free. Next slide. As a Team Nutrition school, you will also be eligible to apply for the Healthier U.S. School Challenge Smarter Lunchrooms Award, and will have the opportunity for your activities to be highlighted nationally. To join the team and become a Team Nutrition school is just a few easy steps. From the homepage of Team Nutrition, click on Become a Team Nutrition School under How to Apply on the left navigation bar. You can also use the online search to see if your school is already signed up to be a Team Nutrition school, and check to see that the contact information is correct, and you can actually go in and update the information that is out of date. So be sure to use that link and check out Becoming a Team Nutrition School. So now let's get into wellness policies. If you are looking for a simple summary of the final rule requirements that Debbie just went over, we have a double-sided PDF that provides a nice overview that you can share with everyone involved in your wellness policy. It also includes some links to resources, which I will cover shortly. I believe that Jill put those in the handout, so you have this final summary rule, summary of the final rule in your handout section. Next slide. The Healthy Meals Resource System is a USDA website that has all of the resources that I will present today, including the summary I just mentioned, along with hundreds of other resources. So I really encourage you to start on this website and navigate around the different wellness pages to help you get started. Of course, the Action for Healthy Kids wellness tool is on the website in many different locations. The first link that you see on this main page is the wellness policy process. I'm sorry, Jill, if you wouldn't mind going back to that slide. Thank you. So you can see there's 4 sections on this main page. First, you have the local school wellness policy process. So this has sub-pages: assembling the team, model policies, which I'll show you in a minute, evaluation resources, and much more. So that's the heading you'll go to for those types of topics. The second link on the main page, shown on the slide, has the wellness policy elements. So the sub-pages include links to nutrition education resources, resources on physical activity, healthy fundraisers and celebrations, along with other elements like school gardening. Then you'll see the other links are a little bit easier to navigate, where it has success stories and best practices, as well as funding opportunities. So as Debbie mentioned, there is a new requirement for evaluation of your wellness policy that includes how your wellness policy compares to model policies. Not only is this a requirement, but it is helpful to look at other model policies to get ideas for new goals as you continue to refine and update your policy. Team Nutrition has compiled a list of model wellness policies that you can use to compare yours to and as inspiration. These model policies can be found on the Healthy Meals Resource System using the web address on the slide. On that same page of the Healthy Meals Resource System, you will see the model policy developed by the Alliance for a Healthier Generation. The original model policy that was developed under the proposed rule for wellness policies was thoroughly reviewed by USDA and in compliance with the statutory requirements for local school wellness policies. We expect a revised version that complies with the final rule to be available this fall. It is fully customizable and comes in a Microsoft Word document, so it's easy to cut and paste into your wellness policy. And as Jill talked about, it's not a one-size-fits-all, but it's nice to have these little pieces that you can adjust to meet your needs. Another resource you'll want to check out that is on the Healthy Meals resource system is putting local school wellness policies into action, stories from districts and schools. Because the focus of wellness policy is now more on implementation, we have heard again and again from schools that it would be helpful to have stories from districts that put the wellness policy into action. CDC, Centers for Disease Control, worked with USDA to develop a collection of stories that highlight districts and schools that have successfully implemented components of their district wellness policy. The resulting 11 stories focus on the steps taken to implement the various aspects of their policy. The stories provide best practices that other schools and districts can duplicate when implementing their own wellness policy. Now I want to give you a sneak peek into a resource that will be available this fall for all schools to use to help communicate with parents and other school staff about their wellness policy and get them involved. We often hear that parents and school staff don't even know that there is a wellness policy. This toolkit helps close that communication gap by making everyone aware that there is a policy and providing specific examples of how they can get involved. It will include customizable templates, including a letter to principals, a parent flyer in both English and Spanish, presentation slides for staff, as well as presentation slides for parents, a newsletter article, and social media posts. The presentations are a really nice feature because they're short, so they can be added to other slides and topics you need to cover. So if you're giving an update to school staff, you can just add in some of those slides as part of that toolkit to make sure everyone is also aware of the wellness policy. The toolkit will be downloadable and will be online only because you need to make sure that you customize these resources. So the goal for the toolkit is for the staff member that is responsible for the wellness policy, so sometimes they're titled the wellness coordinator. They're going to take these templates provided by Team Nutrition, edit them with the specific information like their website, where they have the wellness policy, the wellness committee meeting times, and then they're going to send it to the principals and other school staff. School staff can then send the flyers home to parents, post them around the school halls, hand them out at back-to-school night. The presentations can be given during PTA or PTO meetings, at staff trainings, and like I said, can be cut and added to meet your unique needs. You can then use the example social media post with a picture of one of your healthy celebrations to show how your wellness policy is working. This toolkit will be a great way to inform various stakeholders of your wellness policy and to get them involved. We expect the toolkit to be available in the fall, so be sure to check the Team Nutrition website, follow us on Twitter, or sign up for the e-newsletter to be notified of its release. Another resource you can use to spread the word about wellness policies is the Team Nutrition Healthier Middle School Kit. It includes materials for multiple audiences, including parents, principals, teachers, students, and school food service. These materials were tested to confirm the way the information is presented would resonate with their intended audiences and make them more likely to get involved in school wellness. There is a double-sided flyer, and there's videos that are short but really get the message across on how those individuals have a role in wellness. Here's just a look at the entire kit to bring everyone together to promote student wellness and prevent childhood obesity. In a couple of minutes, I will show you how you can order these awesome materials for free. Team Nutrition also just released a new resource to help everyone involved in offering snacks in schools, like parents and principals, to understand the standards. Since these standards must be part of your wellness policy, which Debbie covered, this is a great tool to help make sure everyone understands them and make sure that it's actually being implemented. The resource is called A Guide to Smart Snacks and is currently available on the Team Nutrition website to download. Printed copies will be available for order in time for back to school, so in September we expect them. In addition to the new guide on Smart Snacks, you can share the Team Nutrition brochure with parents and school staff to provide ideas to use healthy choices for fundraising that sell only non-food items or foods that meet the Smart Snacks nutrition standard. There are 4 successful fundraising stories from schools that have raised money in a variety of ways that you can learn from. This brochure is currently available to download only. There are lots of information on different healthy fundraiser ideas and resources out there, which Jill talked about as well. And so they're all on that Healthy Meals Resource System website, so you can check those out there. You don't have to create them on your own. Team Nutrition also has a resource to support your efforts to promote nutrition and physical activity at school events. This super fun Team Nutrition Popular Events Idea booklet targets grades kindergarten through 8th grade and presents ideas for 20 themed events, both large and small, and spotlights of real-life events at schools. The booklet includes handouts, different templates, and other free resources to support your event. My favorite part of the booklet is the Schools in Action section that provides examples of schools that have conducted the idea. For example, the Color Day celebration of fruits and vegetables idea highlights Country View Elementary School in Winfield, Kansas. They hosted an Eat the Rainbow event with more than 400 students and parents to sample a variety of colorful fruits and vegetables and vote on their favorite from each color group. Lots of parents commented on the varieties they had never tried before and felt really good about the school's effort to promote healthy eating. Here is a snapshot of the great templates included in the Popular Events Idea booklet that you can tailor to engage parents, the community, and the media in your school event. There are many more Team Nutrition resources for nutrition education and promotion that I did not go over, so you should really check out our website and share the website with parents and teachers. Many of our materials are available in print for free. If you haven't gotten it yet, they're free. So make sure you use the resource order form that is shown on the slide. You can also just check out any of our materials without having them printed online through our resource library. If you have any questions about the Team Nutrition materials we covered today, please feel free to ask them when we open it up to questions, or you can email us at the email address shown on the slide. Be sure to follow us on Twitter to stay on top of all of the latest Team Nutrition news. And with that, I'll turn it back over to Jill to address some questions.
Great, thank you, Erica. Questions are coming in, so I will begin to address some of them. And just a couple comments as well. We did have a comment that someone said about the Team Nutrition booklets. They said they're great to use during their summer meals program. So a testimony right there. Well, I got you on the line here, Erica. Who is eligible for Team Nutrition school status?
That's a really great question. So any school that participates in child nutrition programs, so if they are in the U.S. or some that are abroad but on military bases that are involved in the National School Lunch Program or School Breakfast Program, all of those schools are eligible to become a Team Nutrition school. At the moment, it is not open for child care centers or pre-K. It is just for the schools that are kindergarten and above.
All right, thank you, Erica. Actually, a question for you, Debbie. In regards to the marketing of non-Smart Snacks approved items during the school day, how do we address gyms that use both basketball games and that are used for both basketball games and PE class that have labeling or advertising on the scoreboards?
So that's a great question. Scoreboards, we understand, are existing equipment. It would be probably expensive to replace. So we're not asking that that those kinds of large equipment is replaced right away. However, as you begin, as these materials begin to deteriorate or it's time to replace them, we do ask schools to take the marketing restrictions into consideration when they are replacing it.
And Debbie, would that also be when if they have a contract with a beverage vendor or whoever has the scoreboard, when that contract expires and it's up for renewal, that's when they would need to be in compliance?
That's absolutely right. Mm-hmm.
A question that actually I think both Debbie and Erica can probably help with, and Debbie, if you want to address it first, it talks about funding is always a challenge. How does the LEA's funds from school nutrition be used for nutrition ed and physical activities? So is there any funding available, or how can we use some of the FNS funds for nutrition ed and physical activities?
That's a really good question. We're not providing money for the updated wellness requirements to be put into place, but a lot of this is already in place anyway. But as far as for some of the updating some of the standards, we're not offering extra funding. Erica, is there anything you might be able to add on that?
Sure. So I would
answer.
Yeah, I would also add just that we have the Teen Nutrition Training Grants. Those are available to state agencies. It's a competitive process, but we encourage all states to apply. And we have been able to have them out every single year since 1995. So it's really a stable resource for funding. And as part of the Teen Nutrition Training Grants, the state agency can provide sub-grants to schools to conduct wellness activities. And so many of our grantees choose to do that. So I highly recommend contacting your state agency to find out if they have a Teen Nutrition Training Grant, because you could let them know that you would be interested in receiving a sub-grant or attending one of their trainings and taking advantage of the materials that they put together. And if they haven't applied, encouraging them to apply so that you would have access to that funding source. And as I mentioned earlier, there are resources on the Healthy Meals resource system for funding, and would encourage you to look to organizations like Action for Healthy Kids for additional funding sources.
Great. Yeah, Teen Nutrition grants are wonderful. And for our state agency staff on the line today, another plug for great work you do, and getting that out to your schools in terms of back to school kind of stuff, letting them know the resources that you have. A question came up in the beginning, Debbie, when you talked about actively seeking members for a wellness committee. How do you define actively seeking members? Is sending an email enough?
Yep, that's a great way to actively seek members. You could put it on the website, even in a newsletter, just announcing that you're looking for members, or asking if anyone wants to be interested. It could be in a meeting, it could be on a website, it could be in a newsletter. There's a variety of ways to meet that requirement.
Okay, now we're getting into some of the nitty-gritty here, looking at the marketing policy. And first of all, can you clarify, if the LEA doesn't have anything in their policy about restrictions on what is served or given away, what should they include in the policy?
As far as, this is regarding the piece about foods that are
what is served or given
away.
Yes. Yes.
So, we don't have anything strict about what needs to be put into place, but there are a variety of policies that you could put on foods like that, whether it's restricting the number of times that you're allowed to do that during the year. It could be actually, we know that many LEAs are going to have that be consistent with smart snacks. That could be kind of a more strict standard. Or the LEA could have their own, create their own specific nutrient panel of requirements that food would have to meet. There's a variety of ways to meet that, but our requirement simply states that the policy needs to address those foods. So it's up to the LEA on how they want to do that. And through our materials, we will have some, suggested, we'll showcase model policies that could have some, varying degrees of examples
Great, great. So then there'll be some help in terms of other questions, looking for examples that we had here. Now the marketing one. If you're looking at marketing, does that include giving away coupons for food at a fast food restaurant, coupons for rewards, or advertising for funding nights at fast food or restaurants?
So yes, that would absolutely fall into the category of marketing, especially if that's being done during the school day on the school campus. We want to be encouraging the healthier foods. So as long as those coupons or reward tactics have healthier foods, that would be fine. But if they're marketing foods that fall outside of the smart snack standards, then that would be out of compliance.
And another one on marketing. For example, a company may sell food that is compliant, such as the apple slices at one fast food restaurant in their kids' meals. Can they sponsor a scoreboard that's used for physical education classes?
So the restriction on marketing restricts actual food groups, not necessarily the vendors. So you just have to think of best practices. If you want to make sure that you're not representing the actual food that falls outside of compliance. So an actual vendor offering a variety of items would not necessarily fall out of compliance for the marketing restriction. So that could be done.
So it might be that we look at our policy to point towards the healthier items.
Exactly.
Rather than just a blanket, something like that.
Exactly.
Great. And are there any consequences if a school doesn't meet the requirements of this final rule?
Absolutely. Of course, in the very beginning, we will be providing technical assistance during the administrative review, but there is the potential if a state agency finds repeat violations. There is the possibility that funding could be withheld. However, that would probably take a lot of violations. So we are definitely focusing on technical assistance for now.
Okay. A question came up in terms of someone's interested in hearing creative ways to get parents involved in the Wellness Committee. They said, for example, the Wellness Committee in my district meets at 5 o'clock p.m. That alone is a real barrier to participation. And this one came up when I was talking about inviting parents to be involved with the Wellness Policy tool. We do actually have on the Action for Healthy Kids website parent toolkits that are looking at ways to get more parents involved and addressing some of these barriers. But sometimes it just takes a little creativity, like they're asking about here. How do you get these parents there? And one suggestion is to offer childcare or babysitting that a different club or high school activity group could offer, either as a fundraiser or as a free service, to allow parents to attend, the Wellness Committee meeting and other meetings as well. That this way they can come and at least their kids are occupied and they're not, coloring in the back of the room. They instead have something for them. Or surveying their parents to see what time works the best for these parents to meet. Because I agree, 5 o'clock at dinner hour is really hard to get active parents involved. So finding a different time that meets, or if the Wellness Committee could even tag team with another committee that they're before or after the meetings that these parents are involved in, whether it be the parent group meeting or like if there's a district leadership meeting or something that some of these same people are on, they can work through that. But a lot of times it's hearing right from the parents themselves what is going to work the best for them. And then we have a question on the question of how do I find that website that has the customizable wellness policy? And Erica, that is one I think you put on your handout of helpful links. Am I correct?
Yes, it's the Healthy Meals Resource System. You should be able to just Google that. Under the Wellness Policy process, it has a link for model policies, and it's located right on there. You could also go to the Alliance for a Healthier Generation website. There's a lot of different ways to find it.
Okay. And it is now 1 o'clock Central Time. We regret to say we didn't get to all the questions, but we'll take a few minutes afterwards to try to answer some of these to respond to all of you. I want to thank you all for spending some time with us today to go through the wellness policy new final rule and some ideas to put it in action. And again, please take a look at the resources that are in the handout and let us know if you have any questions. So wishing you all a wonderful day, and thank you again.